Hello and welcome. My name is Zaffar Iqbal, and you are watching Mojo Story. I'm joined by Urvashi Prasad, who's battling lung cancer. And one of the causes that triggered her cancer was the surge in air pollution in Delhi. That's one of the contributing factors. She's been battling this disease for some time, and today she joins us. Urushi, can you tell us something about yourself? You have been a cancer survivor, still battling that disease, and it is a non-smokers cancer that's been detected. And one of the reasons is that you live in a very polluted state, perhaps the pollutest in the world.
That's right. Firstly, thank you for having me on this show. And yeah, I uh, am a public health and policy professional, and I was diagnosed 3 years back, 3.5 years back, with this particular type of lung cancer, which is also known as non smokers' lung cancer. And this typically tends to happen in people who have no smoking history. They have not even been around people who smoke, so not much passive smoking either. And so, one of the biggest factors, which is now considered responsible as more and more evidence has emerged, is in fact air pollution, both indoor and outdoor air pollution, which is triggering certain genes to be switched on in people. These genes are in all of us, but they are switched off normally. Air pollution as a trigger can switch them on, and that leads to the development of the cancer. And my cancer is due to the switching on of one such gene, which is known as ALK. So my cancer is also known as ALK positive lung cancer. It's mostly diagnosed at stage 4, which is what it was in my case as well.
Right. And this situation of air pollution just aggravates in the months from October onwards till January. And it's particularly a problem for those people who have weak lungs. They suffer more because of this. We have been talking about air pollution a lot, but it's linked with cancer, and the way that it triggers a cancer because of, fiddling with the genes, or rather triggering them on, is a very concerning thing.
Absolutely, because you cannot inherit mutations in these genes. That's the important thing. Nobody in my family has had this type of cancer, so these are not inherited. These are mutations you acquire because of this environment you live in, which is highly polluted. And as you said, that air quality worsens in this period. But frankly, pretty much the whole year, air quality is actually well above the norms, described by the WHO and other organizations. So we are actually not breathing very good air pretty much through the year. But as you said, at this time, it is almost catastrophically bad, not just for your lungs, but actually for every part of your body.
Right.
And it is causing all sorts of problems, cancer, of course, but all sorts of problems, as doctors have also been speaking about.
It's an extremely worrying thing. But do you think that a lot of attention is not being paid to this aspect? We talk in general terms about air pollution. It's sort of very mechanical. Every year we talk about it, then certain measures are put in place, then after a few months everything is forgotten, then another cycle starts the next year. But the damage that it causes, lung cancer is taking more lives than breast cancer.
That's right. That's right. And that's not a very commonly known fact. Actually, most people think that the biggest killer, even amongst women, is breast cancer or cervical cancer. But actually, it's lung cancer, where mortality rates are very, very high in the country. And a lot of young people are getting it. People like myself, I was diagnosed when I was only 35 years of age. People even younger than me, in their 20s, are now presenting with this type of cancer. And you're right that we tend to make some noise around this especially at this time of the year, year on year. I think governments have come and gone, but the situation has not really changed, because I also feel that somewhere people don't see it as something immediately affecting their lives, like COVID.
Right. Right.
COVID, people felt that, okay, we could be dropping dead, right now. So there was a sense of urgency, which people are not feeling with pollution. But all I would say is that, we are all being served this slow poison. Some of us are suffering it at a faster rate. Some will suffer the consequences maybe down the line. But at the end of the day, anybody living here is really, taking in poison. And so that sense of urgency and the fact that this is a public health emergency really needs to be acknowledged.
Right. When you take a packet of cigarettes in your hand, it says smoking kills. There is a big picture, a very hard picture put on the display. But look at this. This is not even nothing to do with smoking, and it's even more dangerous in cities which are polluted like Delhi.
Absolutely. In fact, now a baby who's born in Delhi is already smoking 10 to 15 cigarettes a day on probably the first day that he or she is born. So, this distinction even between smoker, non smoker is almost getting done away with, because we're all smoking in Delhi, just by breathing in this air. And that is so dangerous. Like you said, we put all these warnings for smokers, but even those of us who have been never smokers are being subjected to this kind of air that we breathe. So it is really an alarming situation, which I think we've just normalized, and that's not
Yeah.
right.
Yeah, it's been more and more normalized. It's being looked as something that is routine that happens year on year, and people are concerned, but that is all that is there. Nothing more than that. There are no emergency measures being taken. Some things are done, but they look more like cosmetic things. Something the patchwork that is being done, but no concrete fundamental solutions that are being drawn.
Yes, that's right. And I think, some of the solutions we've even known. It's not that we don't know any of the solutions, but I think the will to implement has somewhere been lacking or not been strong enough. As you say, people are aware that yes, this happens, but I think that will to take this up on a war footing, and cities around the world have done it. Beijing did it, London did it at some point, because they were all suffering terrible pollution because of industrialization, other factors. But they decided to take it on a war footing and clean up their air, because they realized that outcomes of people, in every way, were being so terribly affected. And there would be no use having just all these industrial activities, economic activities, if people are not even healthy. They cannot even function. So, all these big cities have at some point had to deal with this kind of pollution, and they have tackled it. So, I believe we can also, but we need to take it up in a concerted way as a mission mode on a war footing, and not just keep letting it happen year on year.
Right. And perhaps some lessons can be drawn from what was done in those big cities to clean the air, and same could be implemented here as well.
Yeah, absolutely. And, all those cities have had a multifaceted plan, because, of course, we understand that pollution of this nature, there isn't ever just one factor. In Delhi, the geography is also challenging. The way where where we are located is also a problem, but there's also automobile, there's construction, there's so many factors. And of course, we've had so many discussions on the stubble burning by this point, agriculture. But I think we can come together, and we can find those solutions. It's not impossible, is what I'm saying. And we have, even when I was at Niti Aayog, I know that we worked on certain plans to see how we can bring different ministries, different stakeholders, different state governments, for Delhi and the surrounding states together and work on it. So I know that, there are ideas, there are solutions that can be put in place, but like I said, we need that will for it to really happen. And I think if we can bring that at the highest level, then I think everything else can fall into place, and we can learn from a lot of other examples, as you rightly said. But we can have our own solutions as well, provided everyone is willing, to really come
Yeah.
forward and tackle this together.
Also, there are some people who can manage to leave Delhi during those months. They have those opportunities or those facilities that they can move out, or the resources that they can do it, or the luxury that they can do it, the time and all that. But not everybody can do it. The people, majority, most of the people, in fact, a very small, minuscule section of people can do it. But all the people who live in Delhi have to bear the consequences of this air pollution.
No, absolutely. And, even for me, like I'm in this highly compromised situation. But even for me, I have to come to Delhi for various things, whether it's my work or the fact that my mother lives here or my doctor is based here. We can't all just escape, it's so difficult. And to expect that, we should have this seasonal exodus from Delhi for whoever can afford it. It's not a solution of any kind. Yes, a few people might be able to do it, as you said, but it's really not a solution, and for the majority it's impossible to even do, because for so many of us the city has been home. We've always called it home. I've grown up here, I've studied here, I've worked here, and it's so difficult to just run away from here. And yet so many times I feel, what if I had not lived here so much, I might not have been in this position. So it's very unfortunate. I feel it's quite unfair and unjust on someone like me who has, never done anything in my own lifestyle to deserve this, so as to say, but just, the air I've taken in.
Right, and you say that it's not given that seriousness, that serious thought, like a COVID, because people thought and saw that an emergency has struck them. But this has not looked like an emergency. This is seen that it is a routine matter. Is it also because no survey, no study has been done where there is a data that's out that can alarm people that this is the situation and they need to take some steps on a war footing?
You're very right. Most of the studies, evidence, data we have is globally, is people studying this, researchers studying this outside. I think we need many more researchers to be seriously looking at this in the Indian context, and more so North India, Delhi, really gathering that evidence and making it very tangible for people. Like you
Yeah.
said, COVID was very visible. It was wherever we went, there were reminders that, cover up, wear your mask, maintain hygiene, maintain distancing. We're not seeing that same thing here, so it's sort of invisible. Even though if you go to any of the major hospitals, the OPDs, the respiratory departments, they're all flooded at this time, and even the doctors will say that. Even the ICUs are really, working overtime, but it's sort of invisibilized to us as a society and as people living here as a whole. So if we can find ways, anecdotes, data, case studies, to make that more visible to people, and say that this is real, this is not something which is just happening, in the background to somebody else. It could really happen to you or your loved ones, anytime. And so I think that is something we really need to do. And for that, you're absolutely right. We need better research, also better data, better evidence, and more case studies, really, of how people's lives have changed. Like my life has changed, living in this kind of an environment.
Right. You're right. In fact, one of our teams went to the doctor, to the hospitals to do a story, and they found that all those hospitals were flooded with patients. The OPDs were flooded with patients, people of respiratory problems, particularly uh, old and infirm people. Now, there will be lots of people who will not even be knowing the amount of destruction and damage that this polluted air is causing to them.
Absolutely. And, like you said, there's more vulnerable amongst us. So, obviously, elderly, I think children are very vulnerable. So many children have got asthma, very young children are on nebulizers, things we would never imagine seeing.
Yeah.
Earlier, a few years back, even in our lives, but now it's so normalized, which is scary. And yes, as you said, a lot of these things are not immediately visible. Like, this kind of pollution can also increase risk of early onset dementia, for instance, right? But we don't see it immediately. It might be something that happens in some time. And so I think people also don't realize. They think that, okay, if somebody is vulnerable or they're old, then they will be affected. But actually it can affect everybody. Your blood glucose levels can go haywire in just 1 month of exposure to this kind of air, and you have the top endocrinologists of the city saying that. So we need to realize that everything might not be so long term, or only in the elderly. It can happen to us, it can happen today or in a year or in 2 years time, but if we keep breathing this kind of air, then something or the other is going to go very wrong. We can almost be certain about that.
Yes, and most people think that it will cause respiratory problems. It can even cause an asthmatic attack. But cancer, lung cancer, a direct relation when it interference with the gene function is something that should alarm everybody.
Yes, absolutely. And, these are called oncogene driven cancers. ALK is one, there's EGFR, there's ROS, there's different of these genes which you don't inherit the mutation from your parents or your grandparents or anybody, you acquire it. So you're a perfectly healthy, fit, and fine person who, acquires this mutation because of this kind of air that you're breathing, and you develop this type of lung cancer, mostly at an advanced stage when treatment is difficult, it's expensive, it is very long drawn out, it is not curable at this point, this type of
Right,
cancer. So someone like me has to be on daily medication,
right.
so it's very, very difficult, and it should alarm us that this is happening in people who otherwise have no other major risk factors at all.
Right, it's detected at a very late stage, perhaps at stage 3, stage 4, when the only option left is palliative care. Nothing can be done about it. It's only the choice is perhaps to lengthen the lifespan of an individual. Such is the dangers of this type of cancer that's triggered by this.
Yeah, I mean, fortunately now we do have some newer medications which have come out, which can, you can take sort of pills, you can take tablets, which, like you said, can extend life, but we don't have a cure that is something which is very, very difficult, obviously, when you are a younger person. You don't want to be stuck in this kind of treatment loop forever and ever. So yes, treatments can extend lifespans right now, but you still have this sword hanging on your head all the time. When you have an advanced cancer diagnosis, anything can go wrong at any time. So yeah, it is very, very life changing to get a diagnosis like this. And
Right.
so people must realize the gravity of this.
And what do you, in the end, suggest that some of the few measures that can be taken to at least make people aware about all of this? Because there is generally an awareness about the problem of air pollution and the harms that it causes. But the, the, the intensity of the damage that it can cause, what can be a few things that can be done and said at this time?
I think, humanizing the statistics is also very important for people. People should feel that, okay, this is a story very close to home. This could happen to me. This could be my child. This could be my partner, my parent. So I think, yes, we sometimes put out a lot of data, but just data alone doesn't do it. We have to humanize. That's why I try to tell my story wherever I can, because often people relate more, to a story when told like that. That's why I said case studies of people who are really suffering the consequences. And of course, we have to make what is intangible, what is invisible, much more visible for people, much more tangible. That these are the kind of costs you are incurring because of the air you're breathing. It's not just a little bit of coughing or sneezing or whatever it is, because a lot of people still think that's all it is. It's just an inconvenience.
Yeah.
But we have to make it very tangible that no, you are actually paying a cost. It might be silent today, but it could become visible and very, very difficult at any point in time. So I think that is really required, and we need very strong messaging from our leaders, whether they are political, they are religious, they are spiritual, whatever it is, because people follow these people listen to them, pay attention. So we need very, very powerful messaging to come at all levels. Only then I think people will start to take serious note and not just a passing note that
Yeah.
yes, we have air pollution.
And how long have you particularly been battling this problem?
It's been 3.5 years or so. Yeah.
Yeah. Uh, we hope that you get well soon.
Thank you so
But it's a
much.
wake up call for everybody that what is being seen as a normal routine thing, perhaps an irritant, is a very dangerous thing. It can trigger a disease as grave as cancer. Thanks so much, Urushiji, for joining us today and for sharing your thoughts. And
Thank you.
also, thanks to our viewers for joining in and for watching the Mojo Story. Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.